Mm, okay, let's start.
Yeah.
Hi everyone, my name is Rudy Girjan and my group member is Manpreet Kaur. So we are here for the presentation of pharmacology. It's a creative assignment regarding the drug. So let's see which classification of drug we got. So we got COMT inhibitors. So what is meant by COMT? It's catechol or methyl transferase. Let's see the definition of COMT inhibitors. This is a class of medications that inhibit the enzyme COMT, that is known as the COMT inhibitors. And the catecholamines like dopamine, epinephrine, and norepinephrine are methylated by this enzyme. Levodopa is also methylated by it. So let's see a wonderful picture of how the drug look like. This is actually the 3D picture of the drug. Then next see the mechanism of action of the drug. Levodopa is metabolized by aromatic L-amino acid decarboxylase that is called AA8DC and COMT. Then COMT inhibitors stop levodopa from becoming thiomethyl-dopa. So here the diagram is showing the overall picture of how the COMT inhibit the levodopa becoming 3-O-methyl-dopa. And next is what all are the indications? So the main indication is for the drug is used for the Parkinson's disease over the past 20 years. And we can use the same drug for motor fluctuations for treating the disease related to the nerve, like the motor fluctuations. So next is the use of drug class for different diseases. Actually, the drug COMT inhibitor, the capacity of COMT inhibitor is to stop the levodopa from becoming the methylated 3-O-methyl-dopa, which we already discussed earlier. So this will enable the levodopa's bioavailability in our body. So this is actually the therapeutic effectiveness of the drug. So while taking the carbidopa or levodopa along with the Parkinson's disease, COMT inhibits dramatically reduces off time. So that's a use of drug for the Parkinson's disease. And next, we can see the Parkinson's disease, which is called PD. So it's affect around 1.5 to 2 percentage of the all population over 60 years of age and 40% 4 percentage of those over 80 years of age. So this drug is actually so this disease is actually the second most frequent neurodegenerative illness in the elderly, which is very common. The Parkinson's disease is very common in the elderly with a higher prevalence in men. It's mostly seen in the men, and the Parkinson's disease is brought on by death of dopaminergic neurons in the substantia nigra, the area of the brain that produces the dopamine, which then decreases in the synaptic cleft. Exit toxicity is caused by the breakdown of dopamine by monoamine oxidase B, that is MAOB, which also promotes glutamate buildup and oxidates stress through the generation of free radicals in the body, actually in the brain, the free radicals in the brain. Then progressive physical limits including bradykinesia, tremor, postural instability, rigidity, and impairment in functional performance are signs of the Parkinson's disease. Thus, so here come the use of COMT inhibitors. So COMT inhibitors actually doing to reduce, there is no cure for the Parkinson's disease, but COMT inhibitors help to reduce these symptoms in the body of a Parkinson's disease person. So next see which all are the list of some of the medications coming under the COMT inhibitor. Those medications are opicapone, tolcapone, neticapone, nebicapone, and entacapone. Those capones, those drugs are coming under the list of medicines. So entacapone, some examples are COMT and COMT-less. Then the peripheral inhibitors like entacapone and opicapone are unable to pass through the blood-brain barrier, but tolcapone is crossed by the blood-brain barrier, And tolcapone is infrequently administered because it has a side effect like adverse effect like acute liver failure. Then hepatic failure must be closely watched for a patient who is taking the tolcapone. So hepatotoxicity is not we cannot see the hepatotoxicity which is linked to the entacapone or opicapone. So these type of drugs are actually safe. Then next is the adverse effect. Adverse effects include nausea, orthostatic hypotension, vivid dreams, confusion, hallucination. Then, as we said already, the hepatotoxicity is the main adverse effect, which we can see in those patients taking the tolcapone. Then, diarrhea, drowsiness, urine discoloration, and dyskinesia. So the next details will be discussed by Manpreet.
Okay, so now I'm going to cover the nurse role in evaluating the action and response, the COMT. Patient history include age and medical history in which the nurse can check the age of the patient before the recommended dose and assess for any history of depression or any suicidal tendencies. And next one is the nurse can check the medication history to ensure that there are no concurrent MAOIs, and as they are contradicted with carbidopa and levodopa. And the next one is nurses can do physical assessments, like which can we include check the neurological status of the patients, which will include motor functions and tremors and many more. And then nurse evaluate for signs of depression or changes in the mood, as depression can be a side effects. And then monitor for cardiovascular abnormalities. And the next slide is uh, yeah, and next one is safety assessment, dietary habits. And the first one in safety assessments, we will include like evaluate the patient's risk of falls, particularly due to sudden onset of sleepiness reported with this medication. And then discuss driving restrictions, advise caution due to potential for sudden sleep episodes, and then assess the patient ability to perform daily activities safely. And in dietary habits, instruct the patient about timing meal around medication and advise against high protein diets that can interfere with medication absorption. And the next one is informed consent and right of medication administration. In informed consent, we will include that like ensure patients and caregivers are informed about the delay onset of therapeutic effect and potential side effects. And in the right of medication administration, we will include like nurses should be aware of the right of the medication administration, such as a right time, right dose, and right route, and right patient, and right documentation. And then record each dose administered and including time, doses, and any observed effects. Okay, so next one is tapering dose. Follow recommended protocols for tapering dose if discontinuation or reduction become necessary. And then monitor closely for sign of neuroleptic Magellan syndrome or worsening of the Parkinson symptoms during dose adjustment. And then client teaching and education. In this one, we will like provide written material on the medication schedule and potential side effects also. And then ongoing evaluations, periodically reassess motor functions, regularly check hepatic hematopoiesis and cardiovascular and renal functions as recommended for extended therapies, and then encourage open communication to address any concern or new symptom promotely. Then if client will be like discuss their symptom or any difficulty, then it will be helpful for the nurse to treat it easily. And then the follow up, schedule a regular follow up visit to assess adherence and adjust therapy as needed. And by implementing these details assessment and conditions, nurses can ensure comprehensive care for the patient receiving carbidopa and levodopa therapy, promoting safety and also optimal therapeutic outcomes. And so these one our references. Yeah.
Yeah, these all are the references for which we kind of did the assignment. And that's all about the COMT inhibitors. Thank you.
Thank you.